Hello, everyone, and welcome back to the Outcomes Rocket podcast. I'm thrilled that you guys tuned in for today's episode because I've got the privilege of hosting Dr. Farzad Mostashari. He is the co-founder and CEO of Aledade, very much focused on value-based care for primary care, a very critical part of what we need more focus and attention on in this country's healthcare. Farzad, such a pleasure to have you here on the podcast. Thank you for joining.
Thank you so much. And instead of Aledade, I should have called it Outcomes Rocket.
I like it because that is what it's about.
That's what it's about. Yeah, I love it.
Well, look, you guys are doing brilliant work. I'd love to share that with our listeners. But before we do, tell us a little bit about your journey as a physician, now a leader of this company. Talk to us about your inspiration in the work.
Yeah, I've always been kind of on the border between medicine and public health. I did school of public health, then I did med school. I did residency, and then I did the CDC's Epidemic Intelligence Service. I served in New York City, a health department, and in doing public health work. And then I was in the federal Obama administration working on electronic health records for doctors and hospitals. But the through line has been trying to answer the question, how do we save the most lives? With their combination of medicine and prevention and primary care and care coordination. And then, like throwing a good dose of technology in there. But the lesson for me has been, you got to do it all. You can't just use technology. You can't just change the payment systems. You actually need to join forces with the doctors, the primary care doctors, the whole team on the delivery side, the policymakers on the payment rules, and the boots on the ground in terms of changing the workflows for patients.
That's fantastic, Dr. Mostashari. And you've always been a big thinker, and big thinkers that make things happen, I respect and admire. So talk to us about the work that you're doing at Aledade. How's the company adding value to the healthcare ecosystem?
That is what it's about at the end of the day. And for me, I mentioned that I was in the administration in charge of the rollout of electronic health records. And by golly, we did roll out all the electronic health records. We went from 10% to 90% adoption during the 5 years I was in the federal government in charge of that project. But we didn't actually change blood pressure control, which was kind of why I did it in the first place, was like, with these tools, you can do population health and registry functions and decision support. And the reason was because the business model for healthcare was fee for service. And so those electronic health records got used for, guess what? Billing.
Yeah.
So then Aledade was me desperately trying to find some window in American healthcare where preventing strokes is like much more profitable than treating strokes. And that really you end up working with primary care in contracts that reward those primary care docs for keeping patients healthy and not having strokes. And so we are now 12 years later, almost since I left the administration, we are now the largest enabler of value-based care for primary care in America. And we saved Medicare over $1 billion last year. Which means
in 1 year.
Which means community-based, community primary care docs got an extra $500 million in their bank accounts, which makes me so happy.
And the most important thing is that people are healthier, right?
Right.
Yeah.
You have where I trained at Mass General, it's a very good hospital system, but the blood pressure control rates are in the 70s. Cleveland Clinic in the 70s. Johns Hopkins in the 70s, Mayo Clinic in the 70s. And Aledade's independent primary care docs, just Main Street, USA, community health centers in Mississippi and all, were at 84% blood pressure.
Brilliant.
Because why? Because the business depends on us preventing strokes. So guess what we do? We prevent strokes.
I love that. And when the incentives are well aligned, and this is all part of the ACO REACH direct contract setup, or
it's a variety. We do ACO REACH. We do mostly the Medicare Shared Savings program, which is part of the permanent program. It's not a CMMI pilot or a test. It's part of the permanent way, the Medicare pays
MSSP
practices. Yeah, we got paid. We got a check from CMS of $778 million during the government shutdown. because it's part of the permanent, Medicare pays its bills. So yeah, it's mostly traditional Medicare. And then we're also now have more and more contracts with private payers, with Medicare Advantage payers and commercial payers, so that the practices that are on our platform can do this kind of care for more and more of their patients.
Well, that's brilliant. I love the results. And so talk to us about the model. What is it that you do that's different or better than what's already out there?
I mean, look, when we started, there was easy to be better than what's out there because there was nothing out there.
Yeah.
I was looking around being like, so who's going to do this? Help independent primary care practices take total cost of care contracts and be outcomes, right? Focus on outcomes driven medicine. And now there are a number of other folks. I think what distinguishes us, I would say 3 things. Let's do 3 things. And one is...
I like 3s.
Yeah, 3s. So one is how we do things. 2 is like how we think. And the 3rd is like who we are, maybe. So I'll start with the who we are, because that at the end of the day, like that's the most important thing. It's like, who are you? What makes you tick? And what makes us tick is service. Everyone who joins Alidate is like profoundly oriented towards service. That we're not in it for ourselves. We're in it for helping patients, helping practices, helping society. So that's more the culture of the place. The second is kind of how we approach things is always long-term oriented, because this stuff takes time. Prevention, like preventing strokes, that's not a this quarter thing or a this week thing, right? It's not like fee for service where you do the thing and you get paid. Like it takes years to create the impact, but nothing worth doing is going to be quick. So we're like always going to be focused on the long term, and we don't make short-term penny wise, pound foolish decisions. We've been at it for over 10 years now, right? And I think that shows. And then the third thing is, I mentioned technology already. Like technology on its own isn't the answer, but without technology, you can't build something that scales the way we added 700 new practices for this year. And you just can't do that if you're just doing it the old fashioned way with, dropping people in. And so those I think are the 3 things: service, long-term oriented, and then technology driven.
I love that. And I was going to ask you too, the latest changes in the policy with the access program. How are you taking a look at that as a potentially tailwind or opportunity? What are you guys doing with that?
Yeah, we're definitely looking at it as a potential opportunity. We've looked at so many different models of delivering virtual care or new care models or care programs to patients that would kind of hit the triple shot, right? Of being good for the patient, good for the practice, and good for society, saving money. And it's hard to make the economics work, I'll be honest. But I think the opportunity here is to try something where, at least for the first 12 months, the ACOs are held harmless. And that was quite deliberate on the part of Abe and the CMMI team to not discourage ACOs from trying things and seeing if it works. I think the question for us is, what role do we serve in the access model? Because there's 2 potential roles for us and other kind of enablement partners. One is just purely as distribution, right? Like we have access to the practices and the patients, and everyone knows if you get a warm handoff from a primary care doc to some service, like it's much more engaging for patients than if someone's trying to cold call the patient and be like, hey, I'm offering a service that'll help manage your diabetes. And I was like, who are you? Right.
Exactly.
So one is just being a distribution partner. And I think that we're getting a lot of inbound on that. And the second is, gosh, could we do some of this ourselves? And I think we really have to have a high degree of trust if we put anything in front of our providers and patients. So I think that's the thing that we're sorting through now. And look, no one knows yet what the economic model is yet for access in terms of what are the payments. And that's going to be, I think, a key factor folks are looking for.
Appreciate that. Yeah, no, good lens on that one. And look, a question we like to ask is one healthcare trend or technology that will change healthcare as we know it.
The blockchain, naturally. Trading.
Like, that was awesome.
You're like, how do I? Where do I go with that?
Did that just happen?
That's so 3 years ago. I bring that up because I never bought into the Web 3.0 blockchain, blah blah blah, as this is going to be the thing, technology that disrupts. I do think this AI stuff is. I do. And we're seeing not just the incremental improvement in productivity of coders, but actually kind of being able to do in software things that we just couldn't do before. And so it's pretty cool to be able to have an API call away, just like this unbelievable resource in the foundation models and increasing the open source models. I'm super, super jazzed about the Gen AI pieces, and we're using it in all over the business now.
Is there anything in particular that you're finding like hands down the number one use?
Yeah.
Is it for AI, for notes? Is it like, what is it?
For us, it's the visual language models. So we've always had the philosophy of let's make it hard on us so it's easier on the practices. So we don't force practices to switch to one EHR. We have practices. We have literally 100 different electronic health records that our 3,000 plus practices use. And it's always been the dream of, well, how do I not just get data out of those EHRs, which we can do now for the most part, but how do I get insights back in? Insights that are really fine-tuned to what the doc's doing on the screen. And before, there were these kludgy RPA type approaches. It didn't really work. They were fragile. They broke all the time. And now, kind of the aha moment for me was, I was like, wait a minute, if this kind of visual language model can tell me that what's unusual about this cat is that they have a star-shaped patch on their chest, then it can tell me what's the context of what's happening on an electronic medical record screen. And so we have built over the past 2 years and now deployed to over 1,000 practices our in-house AI agent that can see what's happening on the screen and give just-in-time.
I love that. That's just beautiful. Music to my ears to hear how you and your team are leveraging this technology. And the opportunities is huge. I wish we had more time, but this is great. I love that we're ending on the future of tech, but also the people behind it and making the difference. What closing thought would you leave our listeners and viewers with as they think about 2026 for care delivery?
There's a lot of uncertainty in healthcare and a lot of change that's happening. But one constant is the idea that there should be a way that we can have it all, that we can have more prevention, have lower rates of hospitalizations for patients, that there is also financially the rational thing to do for the practices and helps society make this whole system sustainable. And I feel like after generations of that being a dream, we're now seeing it on the ground in these accountable care models and with primary care docs. It hasn't worked as well with specialists yet. That's someone else can do that business. But what I'm really happy is with primary care, it really works. And I just see the future so bright for us to keep. We're like, 5% of the market of primary care today. And I want us to keep doing this. Do more good is our motto.
I love it. I love it, Dr. Mostashari. And what a great way to close out today. The future is bright. Dr. Farzad Mostashari, co-founder and CEO of Aledade, with us today, sharing the vision and looking in the rearview mirror the past 10 years, the wins and the successes that they've had for patients, for the company, for providers, and ultimately payers as well. Just want to thank you so much, Farzad, for being with us. This has been insightful.
Thank you so much. And I hope you'll agree to sell me the name Outcome Rocket.
Let's chat. Great to have you on.
Take care.
You too.